Most heart patients focus on cutting salt, taking medications, and tracking blood pressure, but there's one major thing they overlook: foods. These nutrient powerhouses support heart function, strengthen blood vessels, and prevent complications. The problem? Most heart patients are missing key foods that affect their cardiovascular health, and if you're not including them, managing heart disease gets a lot harder. Today we're breaking down the top 3 foods every heart patient needs. If you're always tired, dealing with chest discomfort, or struggling to control blood pressure, this video can be a real help for you. Stick around because I'll also share the best ways to prepare them and supplements to make sure you're getting enough. Let's get into it. Food number 1, beets. Beets are one of those foods you don't think about until you learn what they can do, and for heart patients, that should be a top priority. Every time your blood pressure's high, your heart works overtime to pump blood, but eating beets can actually relax blood vessels, making circulation easier. Over time, this natural approach helps keep blood pressure stable. Here's where things get better. Beets are rich in nitrates that your body converts to nitric oxide, which dilates blood vessels, reducing pressure and improving blood flow. It's a beneficial cycle, and most people don't even realize how powerful it can be. Signs you need more beets. The tricky part is that many people avoid beets due to taste or not knowing how to prepare them. Here are signs you might need more nitrates in your diet. Muscle fatigue, especially during exercise, is common because beets help increase oxygen delivery. If you feel exhausted all the time, even after resting well, that's another clue. Beets are key for producing nitric oxide, the compound your blood vessels rely on. Nerve issues like dizziness when standing up can get better with regular beet consumption. If you've been feeling short of breath or struggling to exercise, beets might be the missing link. They help improve oxygen efficiency, so when levels of nitric oxide increase, endurance improves. Even exercise performance or recovery time can be signs, since beets help improve circulation and reduce inflammation. How beets benefit your body systems. Beets don't just improve symptoms, they support multiple systems in your body. Fertility benefits both men and women. In men, beets improve blood flow and can support erectile function, making intimacy better. In women, they improve circulation to reproductive organs and may reduce menstrual discomfort. Libido also improves because beets help regulate blood flow and oxygen delivery. Nervous system: without enough nitric oxide, brain blood flow decreases, memory issues may develop, and cognitive function can slow down. Kidneys benefit because beets prevent inflammation and support proper filtration, reducing the risk of kidney damage. Eye health improves because beets support the tiny blood vessels in your eyes. When consumed regularly, oxidative stress decreases, reducing the risk of age-related eye problems. Heart and blood vessels receive the biggest benefit. Beets keep blood pressure in check, prevent artery stiffness, and reduce inflammation. With regular consumption, blood vessels remain flexible, blood pressure stabilizes, and the risk of heart attacks and strokes goes down. How beets work at the cellular level. At the cellular level, beets help produce nitric oxide, which dilates blood vessels, activate endothelial cells that line blood vessels so they can relax and expand. When nitric oxide increases, your vessels respond better to changes in blood flow. Beets are rich in betalains, which fight inflammation and oxidative stress in vessel walls. Low consumption leaves vessels stiff and inflamed. Beets provide potassium, which balances sodium levels. When they're missing, sodium effects intensify, causing water retention and pressure increases. Best sources of beets. The good news: you can incorporate beets with delicious options. Roasted beets are easy to prepare. Just 1 cup gives you 500 milligrams of dietary nitrates. Beet juice is another powerhouse, with 1 cup providing about 250 milligrams of nitrates with faster absorption. Beet powder makes a great supplement, giving around 200 milligrams nitrates per teaspoon. Fermented beets are another option, giving you about 150 milligrams of nitrates plus probiotics. Beet greens shouldn't be discarded. They actually contain more nitrates than the roots. These foods don't just help with nitric oxide, they also support blood pressure control and overall heart health. Gourmet beet options. If you want something more gourmet, there are plenty of high nitrate dishes that fit the bill. A Russian borscht with sour cream delivers over 60% of your daily nitrate needs while providing anti-inflammatory compounds for heart protection. A French roasted beet and goat cheese salad with walnuts provides around 50% of your daily nitrate requirements and supports endothelial function. If you're craving something indulgent, a dark chocolate and beet brownie gives you over 40% of daily nitrate needs while satisfying your sweet tooth with heart-healthy flavonols. Beet supplements. For those who need an extra boost, supplements can help. but not all of them deliver consistent results. Beetroot powder is one of the best options because it's easy to consume and preserves the natural compounds. Super Beets Premium Circulation Superfood provides 500 mg of nitrates per serving and is great for blood pressure support and energy. Another solid choice is Beet Elite Neo Shot, which also gives 500 mg per serving in a concentrated form for better absorption. These are far better than synthetic nitrate supplements, which can cause side effects and don't provide the same comprehensive benefits. What to avoid? But here's the thing. You also need to avoid foods and habits that counteract beet benefits. Processed meats are a major problem. Their preservatives actually block nitric oxide production. Excessive alcohol makes the body less responsive to nitric oxide because it damages blood vessel lining. Too much table salt makes the benefits of beets less effective because it constricts blood vessels. Antacids, especially when overused, can reduce the conversion of nitrates to nitric oxide. Even excessive mouthwash used can kill beneficial bacteria that help convert nitrates to nitric oxide, making beets less effective. So if you've been feeling tired, struggling with high blood pressure, noticing poor exercise tolerance, or dealing with circulation problems, adding beets could be the missing piece. Food number 2, fatty fish. Fatty fish is one of those foods most people enjoy occasionally, but for heart patients, it's a game changer. The problem? Heart disease makes inflammation worse by damaging vessels, and fatty fish provides the omega-3s that can help repair this damage. High blood pressure strains arterial walls, and the anti-inflammatory compounds in fatty fish help them recover. Chronic inflammation, which is common in heart patients, also accelerates plaque buildup, but omega-3s from fish slow this process down. Certain medications like statins can deplete CoQ10, which fatty fish helps replenish, making deficiency even less likely. Signs you need more fatty fish. The tricky part is that not eating enough fatty fish doesn't always have clear signs. Here are some clues. Joint pain or stiffness. If your joints ache regularly, low omega-3s could be the reason. Getting winded easily is another red flag. Omega-3s are crucial for efficient oxygen use, so if you're breathless with minimal activity, you may be running low. Sugar cravings can be another clue since omega-3s help regulate insulin and appetite. Dry skin or brittle nails can also point to a deficiency because omega-3s support skin health and moisture. Other signs include mood changes, frequently feeling low or anxious, or even memory problems. How fatty fish benefits your body systems. Fatty fish affects almost every major system in your body, so when consumption is low, things start going wrong. Fertility takes a hit because omega-3s are needed for hormone production. In men, low levels lead to reduced sperm quality and motility, making conception harder. In women, it can cause menstrual irregularities and hormone imbalances that affect egg quality. Libido drops in both men and women because omega-3s support blood flow and hormone production, which fuels sexual desire and energy. Nervous system struggles too. Omega-3s protect nerve cells, and without enough of them, stress responses intensify, causing more anxiety, irritability, and sleep disturbances. Kidneys suffer since omega-3s help control inflammation, and without them, the risk of kidney disease rises. Vision problems can also develop as omega-3s are critical for retinal health. Low levels can increase dry eye symptoms and age-related macular degeneration. Heart and blood vessels are the greatest concern. Omega-3s keep inflammation down, prevent arrhythmias, and help regulate cholesterol. Without them, heart rhythms become irregular, blood pressure rises, and strokes become more likely. How fatty fish works at the cellular level. On a cellular level, fatty fish provides DHA and EPA, essential for cell membrane flexibility. They help cells communicate properly so energy can move efficiently throughout tissues. When omega-3 levels are low, cell membranes become rigid, leading to poorer function and worse inflammation. The mitochondria also need omega-3s to produce energy. A deficiency slows this process down, making fatigue and poor exercise tolerance even worse. Beyond that, omega-3s activate resolution pathways that shut down inflammation after it's done its job. Without them, inflammation continues unchecked, making heart disease complications even worse. Sources of fatty fish. The best way to increase omega-3s is through eating fatty fish. Salmon is the top source. Just 3 ounces gives you over 150% of your daily omega-3 needs. Mackerel is another powerhouse, with 3 ounces providing about 100% of what you need in a day if you prefer milder options. Sardines are a great choice, with 3 ounces supplying 80% of your daily omega-3s. Trout is another solid option, giving about 60% per 3-ounce serving. Herring, while stronger in flavor, still offers around 70% per 3 ounces, making it a potent choice for heart health. Gourmet fish options. If you enjoy gourmet meals, there are plenty of ways to get more omega-3s while eating well. Japanese miso glazed salmon with sesame asparagus, 3 ounces, delivers over 150% of daily omega-3 needs, making it one of the most heart-protective meals out there. Mediterranean sardine and white bean stew with tomatoes, 3 ounces, provides about 90% while also delivering fiber and antioxidants. A Scandinavian-inspired dish like dill poached trout with roasted root vegetables, 4 ounces, supplies 80% of daily omega-3 needs, along with potassium and magnesium that support blood pressure and heart rhythm. Omega-3 supplements. If food isn't enough, high-quality supplements can help. Fish oil with high EPA and DHA are the best form since they target heart health directly. Nordic Naturals Ultimate Omega, 1,280 mg per serving, is a great option because it's molecularly distilled for purity. Another solid choice is Carlson Super Omega 3, 1,200 mg per serving, which is rigorously tested for heavy metals. Most heart patients do well with 1,000 to 2,000 mg per day, but since high doses can affect blood clotting if you're on anticoagulants, consult your doctor. What to avoid. Some foods and habits actually make omega-3 benefits worse. Processed vegetable oils are a major culprit because they're high in omega-6s, which compete with omega-3s for absorption. Deep-fried foods increase oxidative stress, which depletes omega-3s by causing them to break down faster. Too much trans fat, especially from baked goods and processed foods, interferes with omega-3 utilization. Alcohol is another big problem. It damages liver function, which is needed to process omega-3s. Junk food is another issue since processed foods promote inflammation, further depleting omega-3 levels. Fatty fish is one of the most underrated foods for heart patients, but it's essential. Without it, inflammation rises, blood pressure control becomes harder, and heart complications develop faster. Boosting omega-3s through fish or supplements can improve heart rhythm, protect blood vessels, support brain function, and even enhance mood. This will help with joint pain, reduce inflammation, and improve energy. Food number 3, dark chocolate. Dark chocolate is one of those treats no one feels guilty about, but if you have heart disease, it matters more than you think. Your heart naturally struggles with oxidative stress. The more inflammation in your blood vessels, the harder your heart works, taking valuable antioxidants with it. Unlike other sweets, dark chocolate helps blood vessels relax. Without it, vessels remain stiff and constricted. To make things worse, stress, processed foods, and high blood pressure drain antioxidants even faster since your body uses them to fight damage. You need to get enough through food or supplements. Signs you need more dark chocolate. The tricky part is that not having enough flavonols often looks like regular heart disease problems, so most people don't realize they're missing out. If your blood pressure has been harder to control even though your medications haven't changed, insufficient flavonols could be the reason, as they help regulate nitric oxide production. Fatiguing easily during activity. That's another sign. Some people even experience frequent headaches or brain fog because flavonols help with cerebral blood flow. If the deficiency gets worse, you might start noticing poorer memory or concentration. How dark chocolate benefits your body systems. Low flavonol intake affects more than just blood pressure. Sexual health. In men, it can affect erectile function since it shares the same mechanism as blood vessel dilation in the heart. In women, it can contribute to more intense PMS symptoms and reduced exercise tolerance, making physical activity more difficult. Skin health. It's also needed for skin health and circulation, so low levels can accelerate skin aging and reduce healing. Mood. Your mood can take a hit too. Without enough flavonols, stress hormone regulation suffers, which puts extra pressure on the heart and increases anxiety. Kidneys also struggle. Flavonols protect them from oxidative stress, and without them, kidney function can decline more rapidly. Brain. Your brain can suffer too, as low flavonol intake has been linked to reduced cognitive performance and memory function. Heart. And then there's your heart. Flavonols help produce nitric oxide, which relaxes blood vessels. When levels drop, vessels constrict, blood pressure rises, and the risk of clots and heart attacks goes up. How dark chocolate works at the cellular level. At the cellular level, dark chocolate's flavonols activate nitric oxide synthase, which produces the vessel-dilating compound that helps blood flow more freely. When flavonols are low, nitric oxide production decreases, so blood vessels remain constricted, forcing your heart to work harder. Flavonols also improve mitochondrial function, so when they're missing, your cells struggle to produce energy efficiently. That leaves you tired and more prone to muscle fatigue. Dark chocolate also influences how your body handles insulin, so regular moderate consumption can help stabilize blood sugar and reduce diabetes risk, a major factor in heart disease. Best sources of dark chocolate. The good news: you can enjoy dark chocolate and improve heart health with the right approach. 70 to 85% dark chocolate is one of the best sources. Just 1 ounce gives you 200 milligrams of flavonols. Cocoa powder is even higher in flavonols, with 2 tablespoons providing about 300 milligrams. Unsweetened cocoa nibs are another great option. 1 tablespoon gives you about 350 milligrams of flavonols. Dark drinking chocolate is also beneficial, with 1 cup providing 250 milligrams of heart-healthy compounds. Cacao beans contain some too, with each tablespoon offering about 400 milligrams, but they're quite bitter. Gourmet chocolate options if you like gourmet treats. Some high-end chocolate creations pack a good dose of flavonols. A Mexican spiced dark chocolate mousse with cinnamon and chili delivers over 250 milligrams of flavonols while adding metabolism-boosting spices to enhance circulation. A French dark chocolate soufflé with berries gives you about 200 milligrams of flavonols and provides additional antioxidants from berries if you want something rich. An Italian dark chocolate affogato with espresso delivers close to 300 milligrams of flavonols while also providing coffee polyphenols that further support heart health. Chocolate supplements. If chocolate isn't enough, supplements can help. The best forms are cocoa flavanol extracts because they concentrate the beneficial compounds without added sugar. Cocoa Via Heart and Brain Supplement provides 500 milligrams of cocoa flavanols per capsule, enough to support blood vessel function without unnecessary calories. Another strong choice is Life Extension's Cocoa Elite, which offers 200 milligrams per serving for those who prefer a lower dose since flavanols work cumulatively. Start with 200 to 500 milligrams per day and monitor how your blood pressure responds. What to avoid. Some foods and habits make flavanol benefits disappear faster, so avoiding them is just as important. Drinking chocolate with milk can block flavanol absorption because milk proteins bind to the compounds. Processing cocoa with alkali, Dutch processing, destroys most flavanols, so check labels for non-alkalized. Excessive caffeine, while good in moderation, can counteract some blood pressure benefits by temporarily raising it. Sugar-filled chocolate provides flavanols, but the sugar causes inflammation that counteracts the benefits. Heavy drinking is another major problem. It speeds up flavanol breakdown and makes it harder for your body to utilize them properly. Dark chocolate may not be the first thing that comes to mind for heart health, but it plays an impressive role in keeping blood vessels flexible, improving circulation, and supporting healthy blood pressure. If your energy is low, your blood pressure feels difficult to control, or your exercise tolerance is poor, adding high-quality dark chocolate could make a real difference. Conclusion. If you found this video helpful, hit the like button and drop a comment below. Let me know which of these foods you think you need to focus on more, and if you're serious about taking control of your heart health, don't forget to subscribe because we've got more game-changing tips on cardiovascular management coming your way. Thanks for watching, and I'll see you in the next one. Take care and stay healthy.